People often speak about a case they will never forget. Or sorry, hi guys, welcome back to my channel. I'm leaving the hospital now, and I'm just like, I cannot not record this for YouTube, because what do you mean that is the interaction I just had? So part of what we do in the program is that when you are, because I mean we're training at a hospital, right? So before you see, this is the pediatric side of neuropsych. Same thing happens even with the adult side of neuropsych, where you have to go check the medical folder before you see the patient. But anyway, so for the pediatric side, you'll get to see the patient's medical folder like a couple of days before you have a history with them and the assessment. So I leave my house dressed like I have all problems, because in my head I'm just like, no, going to the hospital, I'm gonna go pick up, I'm gonna go have a look at the medical folder, and that's that, you know. Yeah, no wahala, no shaking, nothing to write home about. And I tell you that I get to the hospital, and when I get here, I had to stop recording because it looked like this phone was yeah, it wasn't straight. Anyway, I get to the hospital, I go to the area where the medical folders are, right? To the room with all the medical folders. When I get there, the lady says, madam, we don't have your folder here, it's sitting there with the doctors. I'm like, what do you mean? She says, no, your folder is with the doctors. So in my mind, I'm like, okay, let me call it quits. Let me just tell my supervisor we don't have the folder, sitting with the doctors, it's in the ward with the doctors, let's call it. Because I'm a liker of things, I decide, let me tell the supervisor that this is the situation, but I'm going to the ward to go check if what's happening with this folder, and if I can't get hold of the folder still, and if I can't see the folder. Sharp, I'm walking around the hospital now. As I walk into the ward, reality kicks in that no, ma'am, this is not the admin side of life. This is the sick side of life. This is like, there's ill people here. That's what I mean about the sick side of life. Like, this is where people are, they're ill. There's actual patients here. You know, there's doctors, there's nurses, there's all types of clinicians here. And you need to be confident in why you're here, or else the security guards are going to give you an issue, the doctors are going to give you a runaround, the nurses are not going to have time for you. You need to pump up your chest. I'm just like, chest out. I'm at the door, I'm struggling with the door, first and foremost, struggling with the door, but I'm just like, chest out. My name is Morunga Mungo. I am from Neuropsychology. I am seeing a patient on this day, and I need to see their medical folder. I went to the room with all the folders, and they don't have the folder. They said the folder is here. Can I please have the folder? Speech read. Let's go. Yeah. What a wow. I walk into the ward. Firstly, security guard at the door. First and foremost, security guard wants to know who I am, why I'm here, and all I want to know is please direct me to the door that's open, because the door that I was at now is not opening. Where's the right door? She tells me the right door is that way, and then eventually she calls me back. She's like, are you a parent? Are you looking for your child? Is your child admitted? I'm like, of course she thinks my child is admitted because I'm dressed like this. I'm like, no, I'm a student. You know, this is what I'm looking for. She's like, oh, you're a student. Okay, it's fine. This is the door that you need to be using. I'm like, okay, check. One person, she lets me in. I go in, I explain to I'm walking there. My confidence wants to dip, but I'm like, chest up, bro. If you don't push out your chest, the nurses are going to give you a runaround. The nurses are not going to help you. The nurses don't have time to play. They don't have time to play. I interact with like 3 nurses. They're trying to help me, you know. Eventually I go to this one nurse who now is like, okay, maybe she's going to help me, right? And she's like, where are you from? I'm like, I'm from Neuropsychology. And then she's like, she heard neuro. She's like, oh, you are the neuro doctor. This way. Folder is this way. And she sends me to the folder. But like, that whole interaction was just a lot. Like, talking to nurses, because that's something that we don't normally do, you know. And when we do talk to nurses, they're normally not nice. So now I already have this preconceived notion that this is going to be difficult. This is going to be war. These nurses are not going to help me. They don't even want me to be here. They have time for just doctors. So the minute they hear psychology, it's going to be a mess. They're not gonna want to help me out. And so the entire time I'm just like, Sabana. The entire time I'm just like, babes, you're just gonna have to be confident. You're just gonna have to fight for your place. But eventually it worked out. I got to the folder. I got to meet some nice doctors. But I literally had to keep pushing out my chest, because at some point I went to the doctor's office because, like I said, I spoke to a few nurses and no one could direct me to where this folder is. And it's even worse that I'm insisting on using the patient's surname where everybody else is using the patient's name. So no one knows the surname that I'm referring to. And eventually I go to the doctor's room, and when the second nurse I spoke to, when she directed me to the doctor's room, when she was like, most of the time when a folder is not here, it's sitting with the doctors. You need to go to that room. That's where the doctors are. I was just like, Mo, you're going to be confident. Push out your chest. These are doctors. They know that they run the show. They know that they own the hospital. So if you are going to walk in them all timid, all on some, hello, my name is Mo. I'm from Neuropsychology. I'm looking. It's not gonna work. It's not gonna work. You need to get in there. Sound like you are on the job. Sound like you're serious. You don't have time for this. They are busy, you're busy, you don't have time for this engagement that's happening here. It needs to happen quickly. Hi guys, my name is Murunga Munga. I'm from Neuropsychology. I'm looking for so-and-so's medical folder. I spoke to the lady at reception. I spoke to one of the nurses. They can't find it. They are all assuming that the folder is sitting with one of you doctors. Can I please have the folder? No time for them to ask me, who the hell are you? Why are you even looking for this folder? No time for that, because I look like Kimogele or Siras, Kimogele or Hetigi. Any discussion, guys. Any discussion. We need to get to the point. I was just like, keep your chest out, babes. Keep your chest out. Be confident. Keep your chest out. Be confident. Like, hey, what an interaction. What an interaction. I will say though, by the time I was leaving, my confidence was taking a dip. And it's weird because I wasn't even interacting with anyone at that point. I got the folder and now I'm sitting there with the folder, browsing it through. But now I'm not acting anymore. I'm not in my power suit anymore. I'm just sitting there being my normal self. People are pushing you around. People are busy with whatever. Like, no one has time for you. People are busy with all the things. That's also another thing that shook me when I walked into the ward at the beginning. When I walked in, and that's why I said, this is no joke. This is where there's like sick people, because there were babies screaming from the door, from right off the bat. And I'm like, where am I? Next thing, I look up and it's machines everywhere. Yes, there's beds. I was expecting beds, but like, there's these machines where you're like, what is going on? What plane are we on? It looks like there's like, you see those when a plane is crashing and whatnot, and it was a lot. So I'm just like, where am I? What is happening? So that was my first interaction. That's why I felt like this is serious business. But yeah, come the end, I'm sitting there, minding my own business, doing what I just need to be doing, looking at the folder. And at that point, the power suit came off, and I was just like, I want to go home. I'm tired of being here. I'm tired of acting. I want to go home and just sit in these feelings of, I'm not confident, but I had to play confident, and I played confident, and everybody believed me. But now I'm sitting here by myself, and I'm getting reminded that, nah, that wasn't you. That right there was not the real you. So please don't try us. And I'm sitting there with my feelings, and I'm like, I need to go record for YouTube for this. But I think this is a day I will remember for the longest time. Like, all my insecurities came to play. Everything came to play. Had to interact, because at some point I was asking this lady, when I was looking for the doctor's office, I asked her, are you a doctor? She's like, I'm a dietitian and I can help. I'm like, there's dietitians here too? There's nurses, there's dietitians, there's doctors, there's also doctors that are training, there's supervisors. It's chaotic. There's parents, there's children who are screaming, there's children who look really ill. It's a lot. Yeah, anyway, if you've gotten to this point, thank you for watching. Thank you for listening to this rant. To another Neuropsych day. Bye.